First of all, there are 120 cases today. All of them are locally acquired. Sadly, the department is notified of 2 deaths due to the coronavirus. Yesterday, one woman in her 40s and one woman in her 60s, and all of us send our best wishes, our condolences and our deepest sympathies to the families of these 2 women. In just the last 2 days, the number of cases, the nature of those cases, the depth of the seeding of this outbreak has become clear, and the Chief Health Officer's advice to me and the government has changed, fundamentally changed. None of us have the luxury of ignoring that. None of us have the luxury of shopping for the advice that we want. When we get advice, we follow it, and the data and the evidence and the experts are very clear with us. We will not see these case numbers go down. They are going to go up. The question is, by how many and how fast? What we are all doing, the government, the public health team, nurses, doctors, people working in laboratories and testing clinics, people giving jabs, all of us as Victorians following the rules, all of us are trying to manage 2 peaks. The peak of those who are vaccinated and the peak of those who get infected with this Delta variant. What we must do is suppress case numbers sufficient to buy us time to get people vaccinated. What that means is that we can't ease restrictions today in any profound way. I don't think anyone was expecting that, but it's simply not possible. And in fact, we are in for a difficult time, a challenging time, over these coming weeks. This is very, very tough, but it is simply not possible to make wholesale changes, to have a freedom day, if you like, or an opening up day in metropolitan Melbourne in the next few weeks. That is going to require us to hit our vaccination targets, because that's what gives us the protection against infection, and most importantly, it gives us the protection against hospitalisation. From midnight tomorrow night, the Chief Health Officer has advised that playgrounds can reopen. He'll speak to the logic and the rationale behind that, and also his expectations of how playgrounds will work and the rules that need to be followed in just a moment. Also, the Chief Health Officer has advised that from midnight tomorrow night, some of the in-home childcare arrangements that had been disrupted by rule changes will be able to tidy that up and have some of those, what are principally long-standing arrangements, reinstated where families have authorised workers in their household. That's as far as we can go in terms of changes effective from midnight tomorrow night. Everything else has to stay in place until on or about the 23rd of September, when we get first dose 70% across our state. But if we just put Shepparton to one side for one moment and think about the rest of regional Victoria, we think we will be able to end the lockdown in the rest of regional Victoria next week. Exactly when, we'll confirm as soon as we can.